Hey baby, আমি হাগিজ সুসু টাইম ভাল হৈছে যে তুমি পিন্ধি আছা ইণ্ডিয়াছ ফাষ্টেষ্ট এবজৰ্বিং ডাইপাৰ নতুন এক্স চ্যানেলৰ সৈতে যি অন্য ডাইপাৰতকৈ শুহে বেছি বেগেতে গতিকে তোমাৰ স্কিন হৈ ৰয় একদম ড্ৰাই হাগিজ ইণ্ডিয়াছ ফাষ্টেষ্ট এবজৰ্বিং ডাইপাৰ
2021. To simplify things, basically this is the medical reimbursement that is given to the government employees. Earlier, because of different issues and concerns, we had been following the CGHS, criteria for almost all the different kind of ailments and different kind of treatments that were there, and it was becoming a problem for a large number of the employees. And hence there was assessment that was done by the department, and the department has proposed that we classify different ailments into different categories. And so for the common disease that are there, again this whole list is there, I don't have time to go into all of those things, but basic classification I'm informing you that the common diseases that are there, the rates of the CGS or the MHIS / either one will be implemented. But for the more serious nature, where there is like emergency and life-threatening cases, or there is a rare disease and surgical interventions required, for these, the CGHS rates will not apply anymore. And as I said, especially cases like the emergency life-threatening cases which are there, the cabinet today has decided that we will go for 100% of the bill amount to be cleared as per the treatment that was given. And this will also be done without needing any kind of prior approval at the government level. And the DHSMI will be given the powers to make that decision, so that the process of reimbursement and paying of bills, especially in life-threatening cases, is done without any hassle and on time, so that the government employees can get the support as and when they need it. So earlier there was a lot of procedures were involved, and the different kind of aspects were there, approvals were required, which were sometimes very time-consuming. And more importantly, the rates that were being given under CGS were not enough for the treatments that they were going through. And hence now this will ensure that the amount is given as per actual, and more importantly, as I said, the procedure will be really smoothened, so that the prior approval is not required before they go in, and a simple green signal from the DHSMI will be there. Of course, there are many aspects and many criteria in this. This again will come out in the form of an notification, and that will have more of the details. But in principle, we have done this, as I said, to ensure that the government employees they get support the time they need, and also the amount that is being given. Also, procedures have been streamlined, so we will be actually having a format and a system in which we will be ensuring that certain formats have to be followed in a very simple way, where the inputs that will come in from the hospitals will be taken, so that as I said, the process is made much smoother. So this is being done mainly for supporting the government employees and ensuring that we minimize the problems when they're going for treatment or any kind of emergency life-threatening cases, and operations have to be done on an emergency basis. So this will help all the government employees to a large level. So that's my precise point. If you're going for a private, hospital and working in a commercial hospital or private hospital, that we are not agreeing to. We are only saying that there are a lot of not-for-profit hospitals that are running, and they are also giving service to the people at the end of the day, because these are low cost, low intervention in terms of the costing that's involved. I guess minimum is the best way to say it, which they almost function like a government hospital in one way. So therefore, we strongly felt that we need to encourage and motivate these hospitals who are doing a lot of work, providing the service to the people. And so this is one step towards showing our support to them. Very soon, we are also going to be giving financial support in terms of building new blocks, and giving some kind of financial support to build up the infrastructure in these not-for-profit hospitals. Not all in one go, but we'll start the process. So we felt that these hospitals, they add a lot of value to the health sector, and therefore the government can find ways to support them, and we felt that this is one way in which we will exempt the doctors who are working in such hospitals from the commitments that are there while they were signing the bond.